Hello.
Good evening, sir.
Oh, good evening.
Good evening.
Good evening, sir.
Good evening.
Thanks for coming joining. Sir. So we can start. So we are live on YouTube and we are recording this also.
Okay.
So let me give a quick introduction before we start with. So good evening, everyone. So welcome you all for the third webinar. We are creating awareness on a rising epidemic. I would rather say a pandemic. This is on parental alienation. We are focusing only on the impact on children because it has the impact on the parent as well as the children as well. We are focusing only on the impact on the children. The previous webinars, we had an alienated parent, we had a equality activist, and we had a couple of lawyers who were telling about the flaws in the child custody laws and the new concept called as child independent lawyer. And today we're going to have a medical webinar. We're focusing on developmental sexuality. We have two eminent speakers, Dr. Arun Vishwanath. He's an endocrinologist from Tirunelveli. Dr. Arun's Hormone Clinic. He's a known speaker in various Trendo events, that is the Society for Endocrinology. And he's a very well-known speaker in the field. And as usual, we have a senior professor, psychiatric professor, who's a president-elect of Indian Psychiatric Society, president of South Asian Society for Sexual Medicine, and the professor emeritus in the Department of Psychiatry, also the chief coordinator for psychosexual health course at the JS Academy of the Higher Education and Research. Dr. T.S. Rao, sir, is a mentor for many, and thank you, sir. And it's a pleasure to invite both of them on this webinar, on this show. And I would like to request Dr. Arun to present his topic on understanding developmental sexuality. You can share the slides, sir. Thank you.
Thank you, sir. Yeah, is my screen visible, sir?
Yes.
Visible, sir. Thank you. Yes.
Thank you. Very good evening, everyone. And I thank organizers, especially Natesh sir, for this wonderful opportunity. And I'm honored and humbled to be sharing this platform with Professor Rao, sir. I'll be talking about understanding developmental sexuality. So usually after this COVID, there's been sea of webinars, and most of the time we endocrinologists speak about diabetes, thyroid, and other mundane topics. And usually we have a set of ready-made slides for giving any talk at any point of time. So this, okay. So this. Actually, I'm hearing my echo.
Yes, I've done that. Please proceed.
Okay, yeah. So this topic actually provided me a unique opportunity, and initially I was a bit hesitant whether I'm the right person to be talking about developmental sexuality, because I could definitely talk about the biological aspect, but I'm not really sure whether sexuality should be. Whether you could discuss developmental sexuality purely along biological aspect, biological domain. We always include that social and psychological aspect that is essential part of developmental sexuality. So in this topic, though I'll be discussing more about the biological aspect, I'll be poking into sir's domain, that is psychological and social aspect of developmental sexuality on and off. And I request sir to correct me if I'm if I'm going wrong anywhere. So with this note, I'll start my presentation. So I think we all know that sexuality, we have all become wiser to know that probably sexuality does not only mean that it's a sexual act or preferences, but it's more of a basic aspect of our existence or our human experience that are that are not dictated not only by the biological factors, but also by equally by psychological and environmental factors. And though our understanding of sexuality is constantly evolving, and right now we identify at least certain key components of developmental sexuality That is identity. It may be gender identity or it may be some social identity, where how we perceive ourselves, and orientation that mainly describes our interest. Gender, though identity and orientation are purely, I mean, we are not really sure what dictates the identity and orientation. Gender role is often dictated by societal factors. For example, if we talk about the gender role played by male and female some 50 years back, and if we say the same thing now, it might sound really absurd. Probably we are moving more towards gender neutrality. And other important components of sexuality are behaviors and emotional connection and intimacy. So not really going into the deeper aspect of all these things. I think Sar will be a better person to tell that. But I just wanted to highlight that sexuality, especially developmental sexuality, is a lifelong process, and the sexuality may change in the same person over a period of time during their existence. Our evolution, or I mean, how we understand sexuality has constantly evolved. And again, probably we all know that Sigmund Freud was the first one who actually gave some sort of concrete ideas regarding stages of sexual development. And as you could see from the picture, is I mean, kind of very serious picture, photos. Probably he lived from 1800s to 19 early part of 19th century in Austria. So at the time, most of the time, it was under I mean, monarch regime, and there was a lot of social unrest and talking or discussing about sexuality was more like a I mean, sinful thing. So most of the ideas that he had provided us regarding psychosexual stages of development actually reflects the era in which he had lived. So most of the ideas given by Sigmund Freud, especially regarding sexual stages of development, has slightly gone off the chart now. But anyway, he believed sexuality developed from right from birth till adolescence, and in each, and an individual passes through certain stages from birth till adolescence. And in each of the stage, most of the time, our sexual development just focused on some organs of our body, and in each of these stage an individual will be faced with some sort of conflict. If the individual is successfully able to resolve that conflict, he moves on to the next stage. If he is not unsuccessful, it results in some adult fixation. For example, an infant, the erogenous zone is mostly around mouth, and major conflict is weaning off from breastfeeding or bottle feeding. If there is a smooth weaning off from breastfeeding to bottle feeding, the child moves on to the next stage. And if there is some disturbance or conflict in that stage, it leads to adult fixation and smoking, overeating, anything. I mean, all these things have been considered as adult fixation because the person has not been able to move from the oral stage. I believe I'm correct in understanding this. So other things like Oedipus and Electra complex, penis envy, most of the theories that has been proposed by Sigmund Freud in developmental sexuality has currently not been accepted by many. So, closely following the theory by Sigmund Freud came Erik Erikson's psychosocial theory of development. And probably his theory was the first one, he must be the first person who actually proposed the idea that sexuality develops and evolves across our lifespan. And he believed the social factors play a major role in developing sexuality, or it majorly modulates our sexuality, or our development of sexuality. So he had proposed several stages from birth till end of our lifespan, more like Rajinikanth's Basha movie. There are 8 stages proposed by him, and in each of the stage, the adult or individual will be facing some developmental task, and whether he successfully able to tide over the task, or that actually dictates his long-term social, sexual, as well as overall development. So I'll be discussing these 8 points, in subsequent slides as well. So our current understanding, we currently believe most of the physiological thing, or even for some or many diseases like diabetes or obesity, or any diseases that remains lifelong, we now try to view this problem, both physiological as well as pathological, through a biopsychosocial model. for example, if you are talking about some pathology like diabetes, an individual will have certain biological factor that makes the person predisposed to develop the disease. Then this person gets acted upon by certain environmental and psychological factors, which eventually results dictates whether the person develops the disease or not. Certainly, with regard to physiology, again, our overall well-being or the certain physiological process gets influenced not only by biological phenomena, but also by environmental and psychological aspects as well. So as I said earlier, I'm probably more equipped to talk about the biological aspect, but since sexuality, especially sexuality or sexual well-being, is not entirely dictated by the biological aspect and equally modulated by social experiences as well as psychological aspect, I have to poke into these domains as well in my subsequent slides. So, as I said earlier, sexuality evolves across lifespan. Talking purely from biological point of view, I believe most of us know, but it's not only adolescence where the biological hormones and other things flows in. Actually, the axis that dictates our reproductive health, the hypothalamic pituitary gonadal axis, actually remains active even in fetal life. In fact, the most active time of HPG axis is in the first and second trimester. Then just prior to birth, by the end of or by the beginning of third trimester, it goes into quiescence. And immediately after delivery, as maternal hormone influences wean off, the HPG axis again becomes active. That becomes a mini puberty. Then the axis again goes into quiescence all along childhood, eventually getting reactivated during puberty, right? So the sexual development in infancy, again, we will be talking from the biological aspect mostly about mini puberty. In mini puberty, the HPG axis is as active as an adult male or female. In boys, it peaks around 2 to 3 months. It can last up to 6 months. In girls, it's around 12 months, and it can last even up to 2 to 4 years. Purely speaking from an endocrine perspective, this mini puberty is now is of great interest to us because most of the reproductive problems that a male or female faces in later life can actually be diagnosed by screening during mini puberty. And most of this problem, especially the hypogonadism the patient suffers from because of lack of hormones from pituitary, those things can be diagnosed during mini puberty right from at the time of infancy. And if we could correct the hormonal balances during this mini puberty, most of this negative reproductive consequences can be taken care of. So it's of great interest to us. And since the hormones are active, infants, both male and female, the sexual arousal is quite common. But this kind of sexual arousal cannot be equated to the adult one, where lust when romantic values cannot be added to this. It's merely a response to physical state or sensation, and generally signals overall physical contentment and stimulation of the child rather than orgasmic kind of thing, right? And as soon as the child develops enough motor potential, they actually try to explore their bodies and touch their genitals, but these are merely for comfort or to relieve tension rather than to reach orgasm like an adult. So this is the consequence of absent mini puberty. It has both reproductive as well as long-term physical consequences, not to mention the emotional aspect of lack of mini puberty, which could present during adolescence. Then moving on to early childhood. In early childhood, the HPG axis becomes quiescent after remaining active for a certain period of time. And when we talk about the biopsychosocial model, the psychological and social applications are there. I mean, the psychological and social domains of sexuality development will remain intact, but the biological part will remain quiescent in early childhood. So, especially in toddler 1 to 3 years, self-stimulation is common, and they will be generally curious about their body as well as others' body. And this is the stage where they begin to explore their world. They learn that they can control their action. They can act on the environment to get certain results. They start to show clear preferences for certain elements of the environment, like foods, toys, and clothing. And talking about Erik Erikson's psychosocial stage of development, the task that a toddler faces is autonomy against shame and doubt. So, a toddler who has been freely allowed to act on the environment to their liking, or if the social environment or the prevailing environment is good enough, they will actually achieve autonomy. And if they are denied the opportunity to act on the environment, they might doubt their abilities, which would eventually lead to low self-esteem and feelings of shame. Then moving on in preschool stages, again, the HPG axis or the biological domain of sexual development remains quiescent, but they become increasingly aware of their body. They start individual as well as peer-to-peer sexual play. And in fact, data says that 50 to 80% of the kids engage in some kind of fantasy sexual play, exposure, or stimulation of genitals. In fact, as a father of two kids who are in this same stage, right? My younger daughter is around 3 years, elder one is around 6 to 7 years. In fact, many of the psychologists says that how adult caregivers respond to these kind of activity actually, impacts their long-term sexual well-being. And in fact, as a father of two of the same age, I do not know how to respond to this. And if sir, I would like to pose this question to sir, and if you could answer during your talk, sir, because in my apartment there are around 6 kids of the same age, and whenever you go and see them play, they'll be, they'll be doing this father-mother game or the father and baby game. They'll try to feed each other. All these things will be there, and we really don't know. Both of them, my wife and myself are doctors, but still we do not know how to properly respond to these kind of play, right? So in this state, social aspect, they will be capable of initiating activities and asserting control over their world. So again, going back to the psychosocial development, the task faced by the preschool children are initiation versus guilt. If they have been freely allowed to initiate activity, assert control over their environment, and able to achieve their target, they usually develop self-confidence and, and develop a sense of purpose. But if they are unsuccessful at this stage, they will end up developing guilt and self-remorse. Moving further, again, mid-childhood, that is from 6 prior to adolescence. Generally, if you go back to Sigmund Freud's theory, this is generally considered as a time of latency for sexual development, but that is so not true. In fact, they may not have the sexual curiosity of their earlier years, but if you, many of the studies says that average age of first sexual attraction is around 10 years. And most of the Western literature says that this is the ideal time for initiating sex education. In fact, early initiation of sex education during mid-childhood actually carries long-term benefit in terms of overall sexual health. And psychosocial tasks that a mid-childhood child faces, that industry versus inferiority. They'll be keen on gaining a sense of self and competency in their task and relationship. And if they are unsuccessful, they generally experience inferiority. Then comes the major part of sexual development, that is during adolescence, and this is the sign. This is the time of reactivation of HPG axis, and again, both biological, psychological, and social domains will be in play more than ever in our life. So purely about biological aspect, this is the time of reactivation of HPG axis, as highlighted earlier. Generally, the trigger for puberty starts from hypothalamus. To be precise, it starts from the kiss neurons, the famously named after Hershey's Kisses chocolate. It's from a place called Hershey. So that kiss neurons are named after that place of invention, place of discovery. So the kiss neurons are the one that triggers puberty. It acts on their receptors, GPR54 in GNRS neurons. Then from there, it reaches the pituitary part, pituitary gonadotrope precisely, which releases LH and FSH. They act on the respective gonads. And this HPG axis is a classical endocrine axis whereby negative feedback from the end hormones has a negative feedback effect on both pituitary as well as hypothalamus. So generally, pubertal events in humans follow a certain sequence. In fact, the first sign of puberty in girls is thelarchy, that is breast development, and in boys, it's increase in testicular volume. And a certain sequence of pubertal events in girls, it starts from thelarchy, breast development. It moves on to pubarchy, that is pubic hair as well as axillary hair development, which is followed by growth spurt, eventually resulting in menarche. In boys, it's actually increase in testicular volume that comes first, then comes voice change, then comes pubic hair growth, then comes growth spurt, eventually resulting in spermatogenesis. So from start to finish, usually the mean duration of puberty is around 3 to 4 years. And generally, we document pubertal progression in 5 phases, that is famously called as sexual maturity rating, proposed by Marshall and Tanner way back in 1969, but it's still being used. So in female, we talk about breast development as well as pubic hair growth. One is pre-pubertal and 5 is adult size. 2, 3, 4 are somewhere in between. Now digging in deep into that. In boys, we take note of penile as well as scrotal growth as well as pubic hair distribution. Based on that, we can actually stage pubertal staging from 1 to 5. So age of normal puberty plays a major role in sexual health as well as sexuality development. Generally, the age of normal puberty is governed by race, ethnicity, the child's nutrition as well as socioeconomic status. So overall, accepted age of onset of puberty is around 8 to 13 years in girls and 9 to 14 years in boys. Again, based on Tanner and Marshall's seminal work in 1970s. But globally, because of industrialization and overall improvement in nutrition, this age at onset of puberty gradually getting lowered. So we define precocious puberty. If you see any medical parameter generally follows normal distribution. So those in the middle 95% are considered as normal, and those 2.5 on the either extremes are considered as abnormal. So generally, the cutoff are for any delay or early puberty is based on this understanding. Precocious puberty, we say precocious puberty when the age at onset of puberty is less than 2.5 standard deviation from mean, right? So strictly speaking, this is purely a statistical derivative. We cannot exactly say is that those who achieve puberty in that 2.5% zone are not necessarily abnormal. Same thing can be said about the other extreme end. Those who get delayed puberty are not always abnormal from a medical perspective. But we need to have certain cutoffs, right? So that's why we give this 95% in the middle are considered as normal. So age cutoff, any onset of puberty or any sign of puberty prior to 9 years in boys and prior to 8 years in girls is considered as precocious. Delayed puberty, we define by two terms. One is the absence of pubertal onset or failure of progression of puberty. If pubertal onset has not arrived by 14 years in boys or 13 years in girls, it can be called as delayed puberty. Or if the progression of puberty is delayed by more than 4 to 5 years, it's considered as delayed puberty as well. So what about the psychosocial significance of early and delayed puberty? Generally, they will feel different than the peers. With early puberty, boys will have certain advantage because they are less likely to experience negative consequences because they achieve puberty earlier. There are less chances for them to get bullied. In fact, they will be the bullies in the class because they will be achieving puberty early. But on the other hand, girls will have some problem, in fact, major problem, because not only because of menarche, but there is a greater risk of sexualization of girls because they achieve puberty earlier, and there is a greater risk for abuse. But when it comes to delayed puberty, in fact, both boys and girls experience bullying and other negative aspects. In fact, boys allow heightened levels of bullying and negative self-esteem. So early puberty may be advantageous to the boys, but in terms of psychosocial development, but delayed puberty is definitely bad for them. The exact same can be, exact opposite can be said about the girls. One more thing of greater importance that we are realizing now is that managing adolescents in individuals with gender dysphoria. Gender dysphoria or gender identity crisis actually starts in the mid-childhood phase and becomes more prominent during adolescence or when the child enters into puberty. But technically, most of the gender dysphoria treatment or support that we give actually arrives or actually approved after the child achieves 16 or 18 years of age. By the time they achieve this 16 or 18 years of age, most of the time they would have developed unwanted or gender dysphoric pubertal changes, which will be totally unacceptable for this kid. So starting from pubertal onset till that 16 to 18 years, till they achieve legal autonomy, how to treat them or how to approach them has remained a global concern. In fact, many Western countries, they actually give pubertal arrest with GNRH depot so that the child gets some more time to think about that. And by the time the child enters 16 or 18, depending upon the child's preference, either we allow the puberty to progress or we give them gender affirmation hormone therapy. But in our country, most of the time, the gender dysphoric child will be under parental care or guardian care, and they will not actually allow this to happen. So this kind of an endocrine dilemma that we are currently facing, how to manage early puberty or how to manage pubertal onset in a gender dysphoric male or female child. So again, adolescence, the time most of the sexual activity gets started, romantic relationship gets started, and most of the time the relationship authenticity or inauthenticity actually impacts their mental as well as emotional health in the long run. That is catering to the demands of a romantic relationship, especially in girls, that could actually positively or negatively influence their overall emotional and as well as physical well-being. So again, talking about psychosocial role played by these adolescents, either you'll have identity versus role confusion. We are mainly talking about gender identity crisis at this stage. Then there is a period after adolescence, that is emerging adulthood, that is between 18 to 25 years, where the HPG axis is fully mature. So at this stage, the child or the individual would have left behind the dependency of childhood, but they are not ready to take the responsibility of the adulthood. Probably, if we think back, this might be probably the best time of our life, because we are not entirely dependent on our parents for maybe not financially, for other aspect. Again, we are not bound by our familial commitments. We don't have a wife or kids or somebody to take care of. So probably this is the time where we start independently exploring our life's possibility. Again, the psychosocial contention at this point is choosing intimacy versus remaining isolated. Moving further, early adulthood, that is between 25 to 30 years, where physical maturation is complete and we have reached what is called as a physiological peak. As we reach the peak, the downfall starts. So aging process begins at around 30 years, happens more quickly for men, unfortunately. And it generally manifests as reproductive capacity decline. That's why most of the endocrinologists actually advocates early marriage. Not when I say early marriage, not prior to 20 years. Early marriage means relatively around 20 to 25 is a good time to get married, and at least the first child should be planned between 25 to 30 years. So after 30, our response time declines, ability to recover slows down, and reproductive capacity also starts to decline. Moving on to adulthood, moving on to the middle adulthood, that is between 45 to 69 years. So here the psychosocial task, the SPG axis remains active. The biological aspect is intact, but the psychosocial task that we face is generativity versus stagnation. Either we have a continual need or sense for growth and contribution, or we have resigned to live our life as it is.
क्या
We
मतलब
remain sexually active, but the
हाँ मत
age-related physical changes started affecting sexual functioning at this age. Then moving on to the last stage, that is elderly, age 70 and above. Here, the psychosocial task that we face from Erickson staging is integrity versus despair. Whether we are able to look back at our life in a meaningful way, or if we feel like we have lived our life in a very productive way, or if we are filled with regrets and remorse. Again, this integrity versus despair, the psychosocial task is mainly based on individuals' physical health and well-being at that point of time. And from a sexual point of view, previously elderly people were generally considered as asexual. That is so not true, because it has been fed into our mind for a long time. When we come across certain scenario in our family or in public or in our friend circle, when elderly becomes sexually active, it becomes really difficult to accept. In fact, even for that elderly person, they feel like it's a kind of sinful act. But contrary to what we believe, many older couples actually find greater satisfaction in their sex life than they did when they were younger, because their distractions are fewer, they have more time and privacy, and they're not worried about getting pregnant, and they're really intimate. So they are, most of them are actually have sexual vigor, or they engage in some form of sexual activity. And at this stage of life, the quantity or the frequency does not matter to them. It's actually the quality of engagement that matters the most to most of the elderly people. So to wind up my talk, sexuality, as I said earlier, it develops and evolves continuously across lifespan, and it may change in a person depending upon the social and psychological factor across their lifespan. And like most physiological and pathological things, sexuality needs to be viewed from a bio-psycho-social spectacle, not as a purely biological or a social one. And I believe our understanding of sexuality is still incomplete, and it is likely to remain incomplete. Again, going back to the bio-psychosocial model, we might become more enlightened regarding the biological aspect of sexuality or even the psychological aspect of social sexuality, but not the social one. Society changes or the environment keeps on changing. So probably that domain of sexuality will remain poorly understood. It might evolve across our existence in this planet. So with that note, I wind up my presentation and hand over the stage to Professor Rao, sir.
Thank you so much, sir. It was a wonderful presentation covering all the basics. As you said, I get patient at the age of 87 and all. So age doesn't bar. So when you get patient around above 60, initially they feel so uncomfortable. So I had to make them comfortable. Don't feel like shy. And especially when patients are around 75, they feel they're going to talk to their son or grandson like that, 87. So make them comfortable, ask their needs. And that is, as you said, it's a double-edged sword. Sometimes it is the finding a partner is so difficult for them. That's also there. So thank you, sir. Thanks for sharing your insights.
Thank you.
So now we invite Dr. Rao, sir, for the next session. So understanding developmental sexuality with the perspective of parental alienation, the core topic. Sir, I'm just making you a co-host so you can share the slides, sir. Please wait. I given the acceptance, sir. Okay.
Okay. Okay.
Yeah, thank you, sir. For the late joining, Dr. Rao sir is a president of South Asian Society for Sexual Medicine. He's the president of Indian Psychiatric Society. He's a program coordinator for the psychosexual course in JSS College, Mysore. Very eminent speaker, member of World Psychiatric Association, renowned speaker and renowned teacher. It's a pleasure to welcome you, sir. Thanks for coming.
Thank you so much. In fact, Dr. Arun Srinivas has done my job easy because whatever I wanted to tell, in fact, much of it has been covered. But then, keeping in mind the title that was given to me and how to go about, initially my preparation was related to developmental sexuality. Since I was told normal sexual development, Dr. Arun Srinivas will be covering, and the title that was given was Perspectives on Parental Alienation. At this introductory level itself, let me clarify one point. When we use the word parental alienation, legal terminologies and what that is actually happening in certain countries, more particularly the Western, but recognized nowadays even in our Indian context. Few of those, about 8 to 10 slides, I have taken it from Suresh Badamat. I had a personal discussion with him. And this is related to certain aspects. What are they? So in fact, if you have to just go into a little more detail, arises primarily in the context of child custody disputes, which is characterized by the one parent programming a child against the other. So these are primarily, in fact, social constructs and maybe have some implications related to what we basically call legal and forensic and such other perspectives. This is not the intention of this particular presentation, but because that particular title was there, I thought I'll clarify one or two small points and then actually proceed. What actually has been observed when marital disharmony is present or the issues have gone a little beyond, we have come across quite a few cases where, in fact, one parent undermining another, and this leading into ultimately separation and then subsequently the child custody once the separation has happened, and that leading to range of problems. One is alienator, one is alienated parents, and automatically this leads to quite a bit of difficulty, which has been actually established. The child hatred towards one parent is exaggerated and unjustified since the child does not have reasons for such hatred itself, but only replicates emotions shown by the loved parent, and this leads to quite a bit of difficulty. Ultimately, people have documented that this type of what we call double speak or dual part of living can lead the child to range of what we call as mental and such other related problems. This is taken from Google, and it is very important that it can affect many aspects of the child's development. So one of the important point is actually when parents are fighting, in fact, child becomes the culprit, and it may take the side of one parent to the other, and that may lead to lot many other related problems as and as the child grows. Whether it is a diagnosis. As it stands now, currently, neither in ICD or DSM, this particular problem has been recognized as a syndrome. And it is one of the parental conflict manifestation, and the two with a specific conscious and unconscious mechanisms which have been explained. And a whole lot of data that is available is from the Western countries. We have almost a similar or analogous situation in quite a few, and it range from starting from very personal. Few of the relatives who have gone through this too, from a distant clients whom I actually treating is a problem. I'll not go into too many details. Later, when some discussion happens related to this or somebody is interested in knowing a little more, I'll come to that. So we started with the idea, this whole preparation, as far as developmental sexuality is concerned, those things that are happening which alienates the children from the parents. Here we are not discussing about the problem between two parents, which is actually leading to difficulty. Here the parents in general as one group, and actually what we call the child. Natesh, before I proceed, I just want one small clarification. How many minutes are available to me? There are some videos are there. I can play. That means it will take about 10
You can play, sir.
No problem.
Please. No
Oh.
issues, sir.
So this has already clarified by Arul Srinivas that starting from infancy till adulthood. Youth, when you use the terminology, it is a very broad one. And old age, in fact, what WPA and WHO considers 65 years, young old 65 to 75, and old 75, we are all well aware. And developmental issues are something extremely important to be kept in mind. There are one or two things. I'll be running a little faster, not because of anything, but this is not the primary focus of my presentation today. That is the reason. That means the maximum development of the child happens in the first maybe 5 years. In fact, the brain's development, if you actually have to look at it, maybe somewhere around at the time of birth, it is around 50%. Another about 30 to 35% of the growth happens in the first 5 years. So there are a whole range of psychological, what we call cognitive to emotional to other behavioral issues actually, which have been likely to be considered at this age. And few of the points what Arun was mentioning about what Freudian theory talks about, say for example, anal and such other area where upbringing impinges on certain ways. And Erickson's concepts also have been elaborated. Let me look at it from biological point of view. We all started our life as female because of the hormones and because of certain other enzymes on the surface. In fact, certain things fuse and actually modify what we actually basically call converted into the boy. Till around maybe between 11 and 12 weeks, hardly there is a much difference between what we call boy and a girl. It may look very simple. What actually I was trying to drive home the point was that developmentally speaking, we all started our life as females. That is one. There are plenty of books available based on behavior and other related things, how actually one can understand And I will be trying to look at some of those extremely important points from our understanding today. So sexual behavior and children, whether they can go hand in hand. In fact, it is anathema to think that a child could be sexual itself, according to some other people. And sexual behavior is clouded by cultural and attitudes, values, and many other such other things. Much of the data and literature available is from Scandinavian countries, and hence actually very typically white and higher socioeconomic status children. And from our country, many of the anecdotal reportings, self-reports, and we need to actually look into few of the people who have done the study in this. So when we are trying to talk about child and sex, people believe that this should not be done. And only when certain specific problems, say abuse, teenagers, certain behaviors, parenting the gays and lesbians, other such interests and behaviors children show, which actually parents and others consider actually a little bit problematic. This is where the question arises why we should be very well aware of what is actually precisely happening. Otherwise, we are likely to do big mistake. So, to again going back, few things stir up our culture, like thinking about sex, children, and sex. Sexual behavior in children, for many, is a proof of moral decay in our society. Strong emotional reaction rather than a rational discussion. Let me go back to, in fact, we were at that particular time, Clinton and in USA, one sentence that children and masturbation was presented by the Surgeon General, in Elders, and because of which she has to resign from the post because she thought something very abnormal, and she quoted actually, this was actually one of the comments. And if you try to look at the Frederick's, a lot of work that has actually happened, at one particular time, in fact, it was just said that child sexual abuse can be understood by how actually the child behaves. Few things are maybe true, but a lot of things actually which they considered abnormal and it indicates child sexual abuse was not found to be true to any great extent at all. So 4-year-olds showing each other's their genitals, all children who masturbate even to excess have not been sexually abused is actually same Fredericks, the subsequent actually report on 1992 talks about. So there is a wide difference between how actually we look at it, and from culture to culture, country to country, context, we need to keep it in mind. It is very well documented that everyone has curiosity, and children particularly so, because the whole range of developmental issues that are happening. And because our curiosity is not settled and proper sex education is not happening, and many people continue to actually look into a lot of things to understand, and that is actually it leads to quite a bit of difficulty. We are all well aware the whole important point is actually it is innate or learned. In fact, there are a lot of explanations there. What Freud was mentioned, Erickson was mentioned, and lot many other theories are present. But from context of medical science, the physiology of arousal capacity present from birth, not for birth, from birth. What it means is even the children, in fact, the fetus which is growing in the womb, the babies have erections, female babies have vaginal lubrication. This has been actually documented. And lack of cognitive capacity experienced adults bring to the encounters. And as Arun Srinivas mentioned in very clear terms, that it is not pleasure seeking, but it is primarily a reflex mechanism rather than anything else. This is what actually we need to keep it in mind in case of children. Boys are the weaker sex. Many of us, it may look like a very strange concept that is actually being propounded, but let me tell you, this is actually has been documented in very clear terms that range of things are actually goes along with this particular idea. Now, we don't believe that biologically speaking, or maybe psychologically, or maybe socially, women are the weaker sex at all. Look at biology. See, evolution-wise, if you try to look at the lower animals, there is cloaca, where both reproductive and actually excretive functions are together. And if you try to look at evolution-wise, it has to get separated because there are the two different functions. The women are far ahead actually compared to the men who have stayed back at that particular level. Look at the sperms. In fact, what actually has been documented is actually the egg sperm can survive for 5 to 7 days, whereas Y sperm is actually pretty weak and for 24 to 48 hours. Hence, natural pregnancies are primarily predominantly 70% it is female child. It is about 70% natural abortions are related to actually what we call the boys. You look at all communication disorders. Anybody who is having daughter and son, they will realize the girl child is doing extremely well in many of the areas, but boy lagging behind too. In fact, getting into a lot of difficulty happens not because of anything, but because the whole range of communication disorders are primary domain of actually the boys. We thought women are weak mainly because they are highly emotional, and that is actually the problem. They weep for small, small things. But then that is the capacity God has given. That way they actually survive for much more longer time without any of these metabolic to other systemic disorders. Socially, given the choice, they can do very well. This has been established. And all over the world, people have documented that women survive much longer time than actually men. And when we are trying to talk about a lot many other things which are supposed to be, see, for example, developmentally speaking, one important differentiation what many parents have to remember is boys are little ahead in certain areas. See, if you are trying to talk about libido, I'll come to this point a little more. Say, for example, sexual drive, in case of boys or in men, is actually aggressive and testosterone dependent. Hence, what actually has been documented is they want more and have more partners. Female sex drive is receptive, intense pleasure and intercourse and such other things are not linked. And that is one of the reasons why here the relationship and those type of things actually matter quite significantly. And this is what we call Kinsey's, say, 1950s, what he documented very clearly at that particular time, and it is even today absolutely holds good. Women, and in fact, the girls reach puberty maybe 2 or 4 years earlier than boys. But range of sexual interests and activities is about 3 to 5 times higher in case of boys. Somewhere it actually matches around 35. Hence, one of the best combination is actually the girl who is 2 or 4 years older than boy turns out to be from sexual point of view the best combination. All through the life they can be sexually active, but adolescent is one of the extremely important period wherein so many changes are happening, and boys chasing girls more than girls chasing boys was actually one of the old concept now actually, because things have changed drastically, and even in our country this is one of the things which has been observed. Tanner staging, I'll not go into the details because already it was been mentioned. Slow till onset of puberty, but somewhere adolescent, whole range of things happen. So many changes, unless actually properly educated, can lead to quite a bit of difficulty. So what we need to actually keep it in mind is developmental issues, underdevelopment or precocious development. Is the behavior putting the child at risk? Is the behavior interfering with development? Whether it is violating rule, whether the behavior causing others feel or himself confused, embarrassed, or bad, behavior causing others to feel uncomfortable. So any one of these type of things are present, we need to. These are all actually very classically mentioned that children explore their body, and just to make it a little interesting in the sense to be a little careful, these are all very well. And few of the behaviors, 2 to 6 years, wide range of behaviors, putting sex parts in the mouth, objects into the vagina and anus, trying to initiate sexual behavior, other related things. These are all very well documented. And Freud mentioned, say for example, word actually electra complex was mentioned. What actually many of the times the children, particularly the girls, start their life with actually something missing, and they want to have it. In fact, this is what actually leads to what we call as the many of the behaviors. And was talking about the children behaving quite differently. Girls and boys, in fact, actually they like to look at parents and others and many of the behaviors. Rough and tumble play of the boys too. In fact, very clear cut homely play of girls. This actually has been documented in very clear terms. Girls 18 to 24 months prior to boys, average age of menarche 13 years, breast development, and other socio-cultural factors determine, I'll not go into. And This has been actually very clearly documented.
Chocolate? Good. Chocolate so much actually
Just to demonstrate, just like we have 5 fingers, each one different, each child is quite different. So in some very wide repertoires to others actually very significantly inhibited actually has been documented. And I just put this particular picture mainly because these exhibitionistic and such other behaviors are much more common in case of boys than actually in case of girls. And it actually carries forward for a longer time in the grown-up stage also. And one of the classic example is the child stands on the compound wall, passes urine, and who passes the farthest urine is considered as class monitor. What it actually I mean to say is this exhibitionistic behavior is actually extremely common in boys and all through. In fact, if you try to look at the earlier laws, majority of this starting from whether you are talking about paraphilias, you are talking about hypersexuality, whether you are talking about antisocial personality and many of these type of things, they were all in the domains of male sex. So some important messages what we need to just there are about 3-4 videos actually to make some points understand. All of us start our life with something actually what we basically call being friendly, lovable, and that particular. The point is, many of these things are learned.
Nice. Go all night.
So both the parents have a lot of role to play. In fact, you love each other. The child also will learn how to love and what actually to, how actually to proceed. So learning is one of the extremely important. There were only about 2 videos how the learning can go into the difficulty.
यार मान्या शादी कर रहे क्या अंदर जाके खेलो पापा देखो हम शादी कर रहे हैं
बाबू तुम्हारी शादी हो जाएगी अभी आदित्य अंदर जाकर खेलो
Yes, you like me? हाँ हाँ
और शादी के बाद क्या करोगे
मैं पापा जैसे सुबह उठूंगा और रेडी होऊंगा
और फिर
मन्ना मुझे बैग देगी और मैं ऑफिस जाऊंगा ऑफिस में बहुत सारा पेपर साइन करूंगा और बहुत पैसा मिलेगा so cute man
and then
फिर मैं घर आऊंगा अच्छा फिर मानिया क्या करेगी
और घर आके तुम क्या करोगे
फिर मैं उसे मारूंगा दरवाजा बंद करूंगा सो जाऊंगा नो सोने से पहले मैं खाना लाऊंगी और आप शो करके प्लेट फेंक देंगे. ओके.
These kids grow up believing it's okay to violate women. Look within. Women's safety begins at home.
The point is extremely important. What actually the message is very simple. Actually, the point is how we train them, how actually they are observing. Each of these type of things going to be, in fact, part and parcel of learning. Some people actually may become very sensitive and can lead to quite a bit of difficulty.
नहीं बोला जाता.
क्यों?
अच्छा नहीं लगता.
क्यों? I love you तो बोल रहे.
नहीं अच्छा नहीं लगता ना.
क्यों नहीं लगता है?
अच्छा तो लगता नहीं है. अच्छा नहीं लगता तो अच्छा नहीं लगता.
क्यों
बात
नहीं लगता?
खत्म.
बात करो. क्यों हमें क्या बुराई है? हम कितने अच्छे तो हैं.
आई लव यू नहीं बोला जाता.
क्यों नहीं बोला जाता?
अच्छा नहीं लगता.
अभी हाल तुमने बोला अपने मुंह से.
अरे वो बताया था आपको कि आई लव यू अच्छा नहीं लगता.
बोल दिया. क्या हो जाता लेकिन I love you बोलने से?
अच्छा नहीं लगता.
क्यों नहीं लगता अच्छा?
So, there are some key points of children's sexual development, and I'll just talk about each of these things in a very brief way. Sexual development begins at a very early age and involves much more than just learning about the birds and the bees. Use the information their environment provides to build their ideas about sex and sex-related issues. Ideas about sex and sexuality develop gradually. Use what they already know to interpret new experiences. As children build ideas about gender, sex, and sexuality, they don't always get it right. Sexual development does not occur in isolation. It is connected to other lessons children are learning. Learn in their own individual and unique ways, depending on their age and level of thinking. Lens of an adult uses for looking at and understanding sexual issues is very different from the lens a child uses. Nowadays, there are a whole lot of things actually happening which are quite different. In fact, Dr. Vishwanathan was talking about his children's development. Let me tell you, in fact, my daughter was somewhere around 4 to 5 years. I had come from office and I was about to keep my bag there, and she was doing this fashion walking. I told her, in fact, this underwear is seen. You are not dressed properly. Her comment was, Buddhu, that means a dull fellow. Fashion walking means underwear should be seen. This is what actually what social media and lot many things. Maybe what I'm trying to talk is about 25, 30 years old story. What is precisely happening now is, in fact, they are exposed much, much more earlier than what actually they can understand and actually deal with. A problem-solving deficit disorder, TV, mobile, and such other addictions, what we basically call age compression. What actually used to be learnt in about 10 years, now the children are able to learn in about 1 to 2 years. Lack of compassion. Parents as problem solvers, in fact, can create quite a bit of difficulty. In fact, the child has to learn independently a lot of things. So 12 reasons why just saying no isn't enough. There are again few points for us to carry home. Just to say no is simplistic response to a very complex issue. It doesn't solve the problem. Children will be exposed to some of the harmful influences anyway, at homes of the friends and relatives and at school, in shopping malls and in movie theaters. It doesn't help children understand what they are exposed to in the popular culture. Children need a way to make sense of their experiences. It can cut parents off from helping their children process what they do end up seeing and from having some influence on what they are learning. And we have a great role to play in that. It doesn't help children learn from responsible people who can make responsible choices even within an all-pervasive sexual popular culture. Children end up feeling guilty if not attended properly. Parents end up feeling guilty and inadequate because they don't have the wherewithal to handle that. Stage is set for premature adolescent rebellion, as children are often forced to choose between their parents and their friends. And this is where this what we call parental alienation in another different way actually gets into the picture. It puts unfair blame and disproportionate burden on the parents to solve the societal problem. It lets the media and marketing industries completely off the hook, but that need to change. It allows politicians and others, of course, this is another socially permissible area. And just one small you can't solve this particular problem by what we call wearing very protective garments. There are a lot of other things. And even in medical education, the sex education is missing in a very big way. I don't remember anything significant actually taught in the MBBS school, though I had certain of the best teachers and certain openness related to this. And the, from education point of view, I thought this one a little longer, about maybe 5 minutes video this is, but it will be still good to know about.
Good morning, teacher.
Good morning, students. Today, we are going to talk about education. Sambhog Shiksha. So, now we will learn about reproductive system. This is the male reproductive system. This is the other one. Any questions?
Sir?
Anyone? You? Anyone? Anyone? No? No? Good. Now, obviously, all you young people want to know, how does Yon Sangam happen? Watch carefully. First, Kundali's meet. If you're Manglik, no Sambhog, sorry. Then, parents meet. Then, wedding meet. Then, Swagrat. Now we all know what happens at the Swagrat.
What happened, sir? Tell us now, we don't know.
Beta, the boy inserts his Indian culture into the female values. And then we all know what happens.
A baby is born?
No, stupid! कुछ तो homework करके नहीं आया ना? Please take out a textbook. अभी निकालो books. Chapter 6 पे जाओ. First line पढ़ो.
These are a gift from God.
Exactly. जब आप शादी करते हो तो भगवान आपको एक बच्चा गिफ्ट देता है. हाँ, पर अगर लड़की हुई तो कब पंचायत के थ्रू रिटर्न पॉलिसी भी है.
But sir, how come there are 1.3 billion people in this country?
Very good question, Subramaniam. I'll tell you. 1.3 billion gods into one blessing is equal to 1.3 billion babies. Any more important questions? Anyone?
Sir?
Yes? Anyone? 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 You? Anyone? Nobody? Okay, no problem. Moving on. Now we are going to talk about a very dangerous topic. A lot of young people are doing this badam doodh drinking without suhagrat. This is against Indian culture. That is why the health ministry has removed one documentary that I'm going to show you now.
मेरा नाम मुकेश है। मैंने शादी से पहले प्रीमैरिटल सेक्स किया था। अभी मेरे फेफड़े में सिफिलिस हो गया है।
अफसोस मुकेश बच ना सका। उसकी गर्लफ्रेंड बार डांसर बन गई। उसकी छोटी बहन एक रोडी बन गई। उसके बड़े भाई की नसबंदी हो गई। क्या आप भी मुकेश बनना चाहते हो?
देखा आप लोगों ने, सावधानी नहीं बरतोगे तो ऐसा ही होगा। इसीलिए वी हैव टू गो बैक टू सम बेसिक्स। क से कहो ना प्यार है। डू इट ओनली विद समवन यू लव। फ से
खिलाड़ी।
करेक्ट। डोंट बी अ प्लेयर। अब की बार एक ही से प्यार। फ से किसने डाला है ना से? ग से गदर। Don't do it with a Pakistani. ग से गजनी। Don't forget Indian values.
Sir, but how is it even relevant?
So you haven't even taught us anything.
Hey, this is government approved syllabus.
But sir, we already know more than this.
So we are almost 18. Do you think we are stupid?
ठीक है, पूछो क्या पूछना है?
What is homosexuality?
Homosexuality नहीं, homo sangam. अरे boys and boys are not part of Indian culture. Boy marries boy, no dowry. Next.
So, but what about lesbians?
हाँ, lesbians are nice बेटा. I like girl on girl. You see, girl marries girl, double dowry. Nice, no? Next.
Sir, this is nonsense. How can you call this a sex education class? I mean, which era are you living in? This is 2014. Do you not watch movies? Do you not use the internet?
Hey, you do not try to teach me your internet nonsense. Indian values are bigger than internet.
Indian values don't create babies. Sex does. You're teaching us here about sex and you refuse to say the word. Say it, na, sex. 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 Why are you not saying sex? I mean, it's just that simple. Sa say sex. Sex. Sex.
Who's it? हाँ? किसका फोन है? हाँ सर। सर मेरा बड़ा व्हाट्सएप वाला जोक था, सनी लियोनी को बहुत अच्छा था। हाँ सर, क्या कह रहे हैं? No, I 100% agree, sir. Of course. हाँ सर, मैं भी. Okay, sir. Okay, students, the syllabus has changed, so please close your textbooks, burn them. Government of India has decided that sex does not exist anymore. New syllabus says sex is a myth, like Godzilla, Anaconda, orgasm, G-spot, global warming. ये सब नहीं चलेगा. Next week से हम कुछ नया पढ़ेंगे. Self control and meditation. तब तक के लिए class dismissed. Thank you.
अबे इससे ज्यादा तो मैंने यूपॉन पे सीखा है बे।
तो तू भी गलत चीज देखता है। यूपॉन पे तो कुछ भी नहीं है रे। रेड ट्यूब देख, रेड ट्यूब।
Guys, you are so immature. Kids videos. They have HD.
So there are actually efforts to actually make the children understand what is good and what is bad, how to overcome. And this particular area is actually becoming something very important, and the children need to be educated properly what is actually the right thing to do.
एक अजनबी एक 8 साल की बच्ची से स्कूल के बाहर मिला और उससे बोला, तुम्हारी माँ एक मुसीबत में है, इसलिए तुम्हें लाने के लिए मुझे भेजा है, मेरे साथ चलो। उस बच्ची ने बिना झिझके पूछा, ठीक है, पासवर्ड क्या है? इतना सुनते ही वो आदमी निरुत्तर होकर वहां से खिसक लिया। दरअसल माँ बेटी ने एक पासवर्ड तय किया था, जो आपातकाल में माँ के द्वारा भेजे गए व्यक्ति को मालूम होता। बात छोटी सी है, परंतु नन्ही सी सूझबूझ बड़ा संकट टाल सकती है। अभिभावक बच्चों को विद्यालय में मोबाइल नहीं दे सकते, मगर पासवर्ड तो दे सकते हैं ना। तो क्या ख्याल है आपका? आप
This is one what we actually parents we need to do.
पापा पापा, क्या मैं आपसे एक सवाल पूछ सकती हूँ क्या?
हाँ पूछो।
आप 1 घंटे में कितने पैसे कमाते हो?
ये क्या बेहुदा सवाल है? मैं कितने पैसे कमाता हूँ, कहाँ से पैसे लाता हूँ, क्या करता हूँ, ये तुम्हारा काम नहीं है। समझ आया ना?
मुझे जानना है कि आप 1 घंटे में कितने पैसे कमाते हो।
तुम्हें जानना है ना मैं 1 घंटे में कितने पैसे कमाता हूँ? तो सुनो, मैं 1 घंटे में 100 रुपए कमाता हूँ, ठीक है?
मुझे 50 रुपए दे सकते हो क्या?
क्यों? किस लिए चाहिए तुम्हें 50 रुपए? ताकि तुम वो स्टूपिड सी डॉल या टेडी बेयर वो सब खरीद सको? हाँ? और अगर तुम्हारा रीजन यही है ना, तो चुपचाप अपने रूम पे जाओ और जाकर सो जाओ। आया समझ? 50 रुपए चाहिए। क्या होगा? मम्मी की याद आ रही है? तुम्हें पैसे चाहिए थे ना? तुम्हारे पास पहले से पैसे हैं, तो तुमने मुझसे पैसे क्यों मांगे?
बस पहले से पैसे कम थे। पापा, आप 1 घंटे में 100 रुपये कमाते हो ना? क्या मैं आपका 1 घंटा खरीद सकती हूँ? मेरे 100 रुपये। शाम को वापस आ जाना जल्दी, हम दोनों साथ में खाना खाएंगे।
इस वीडियो के जरिए मैं आप सबको यही मैसेज देना चाहता हूँ कि अगर कल को आप मर गए तो आपकी कंपनी तो आपकी जगह किसी और को नौकरी पर रख लेगी, लेकिन आपकी फैमिली और आपके दोस्त आपकी जगह किसी और को नहीं दे पाएंगे। तो दिल लगाकर काम करिए।
So it all depends on how we actually bring them up. And the message is one of the very critical period is actually the development of the children. And we publish this book, Journal of Psychosexual, freely available. Google it. In fact, it is an open access. And there are some publications from our side which actually cover many of these aspects. If there is question and answers, we'll definitely participate. The important message is sex education is one of the important area. Developing children and how we bring them up makes a world of difference, and one should be very well aware of this particular aspect.
Thank you so much, sir. So, any question, audience can unmute and ask or chat. There is one question which I'm going to ask, sir. Like, what age do you start masturbating? Prashanti has asked.
This is for whom? For Arun or me?
A common question was there. So, if Dr. Arun is there, he can take.
Arun, you would like to tell?
Yes, sir. I mean, I can. That depends on two things. One, the child ability to start spermatogenesis. So, in that way, technically, a child can masturbate on an average around 13 to 16 years of age. Some sort of spermatogenesis will be there. but the child needs to learn the technique of masturbation, right? So that might depend on their social, surroundings. So technically, they can masturbate around 13 to 16 years of age. But again, I've had a patient who was never masturbated even till marriage. So it depends on their ability to. The knowledge about masturbation needs to be there. So that may differ from person to person.
Is it for both sexes, sir? This age group?
Yes, sir. I mean, again, they can technically masturbate, but the ability to, the knowledge about masturbation needs to be there.
Can I add one or two points?
Yes.
See, many of the times, very young children also, in fact, this is what actually Aruna was mentioning in that developmental, this thing, touching the genitals or presenting any of these other rhythmic related activities, because these are all pleasure giving. And many people, parents and grandparents, bring the children because this fellow is actually masturbating, what need to be done, and a whole lot of such things. These are all extremely common misconceptions. I have done my PhD in a syndrome, what we call Das syndrome, wherein people believe, at least in our country, that brahmacharya and other relatives will be followed, and masturbation creates difficulty, and a whole range of syndromes which have been documented, which go by anxiety, depression, phobia, neurasthenia, infectionsthenia, and many other such these things. So these are all common. It may vary from child to child, but basically somewhere around what actually Arun was mentioning holds good, if you are trying to talk about adult masturbation.
Thank you so much, sir. I think we have crossed 9:20 hours. I don't want to take more of your time. So I think we can, if there's no doubts, we can close the session, sir. But I have one personal suggestion. Like, have you come across any child of parental alienation and you experience with by engaging them? It's called reunification therapy and all is there.
Okay, you see the point. Very recently, just maybe about a month ago, this particular patient, I am treating him for almost maybe 14 or 15 years. He had come, and one of the point made is that wife is no more now. Just about the 3-4 months earlier, she has died, and he was feeling very relieved, but because she has died, he came out of the house mainly because they were not allowing him to stay. A whole lot of ideas created in the children, and house what he had built, and they were coming up and all of that. Children wanted to be with the father, but never allowed to stay like that. And following the death of wife, they realize actually what some of the whole issue, and he also feels so much relieved that he could reunite with the children. See, these are all, if you go into a little more nuances, these are pakka typical case of parental alienation syndrome. You got the point.
True, sir.
Many of the time we are treating this case as a depression, and we are treating him with antidepressants and maybe some amount of counseling. But we are going to look at it a little more seriously and try to help the individual adequately. We definitely need to keep it in mind many of these type of things which are present.
True, sir. So by treating them for depression, we're actually not giving the right solution for him, sir. I'm just asking you.
That is there. But the whole point is, say, for example, in a busy OPD, he comes and anxiety, depressive, and such other symptoms, what he reports, and for a long time. And we were treating him as double depression because there are so many other family stresses are there, plus depression is there, and a little bit of maybe supportive psychotherapy was happening. But we never understood in terms of that this is a parental alienation syndrome, a label that can be given, and maybe worked on that particular area a little more seriously. We never thought in that line. Now,
So that is what my idea of discussion is. What if a diagnosis of PAS is given by psychiatrist, and this father can take it to the court to argue like that?
Let's see, the whole issue. One is we psychiatrists are not understanding. You imagine what court will understand, and others concerned will understand actually. Like, no, you got the point.
True, sir.
By the time we realize that this is actually this particular way, this could be labeled as maybe parental alienation syndrome. Here, one of
At
the
least can you diagnose that parental alienation behavior
See, when you are trying to talk about either in legal terms or
No, not
diagnosis,
legal terms, sir. Your diagnosis, for example, if a female is coming and if she is termed as a BPD.
Allah, to establish that it takes a lot of time. It is not easy. Some things may be apparent straight away in some family and interactions. But many of the times, by the time you recognize that this is a problem like this, takes a lot of time. See, in this particular case, it's a question of around 12 to 13, 14 years which has gone on. And now, in fact, this problem has got solved because the wife died. See,
Problem solved.
the unfortunate situation, but all said and done.
Understood.
Maybe it had not happened in that particular way. There was not possible at all like that. Children having love and affection and never allowed to express either the love or affection, or many of the times given very negative ideas towards the father.
But the father was able to unite with the children, sir. Was he able to unite?
Because, see, once in a way he has met, but mother was so rigid and strict and violent sometimes that it was not possible for the children to interact with him and things like that.
So still after her death also, it continued.
After the death, in fact, the children only expressed that we all should live together, daddy come home and all of that. And he only had the built house, that particular house and all of that.
So they realize,
Yes,
even though they have been alienated, they have the mind.
Yes.
Okay, that is good.
Now it is a reunion, and in fact, now he is feeling so much better and he is very happy.
Understood, sir. Understood. Sir, there is one more question. Mr. Prashant has asked, how to assess the capacity or the cognitive function for a child who is affected by parental alienation? Example, about take medicines related to ADHD, neurodivergent conditions. A lot of time, child is forced to take the view of the insecure parent. In the chat box, it is there.
How to assess the capacity, cognitive function for a child who is affected by parental alienation. Example, about taking medicines related to ADHD, neurodivergent condition. Forced to take view of the insecure parent. See, this is an unfortunate situation, and unfortunately, it goes that particular way. Many of the times, the children with either a neurodivergent conditions or ADHD or other related disorders, issues are something totally different. But what actually has been mentioned is, for a proper healthy development of sexuality, presence of both the parents and see a few of the things what actually Erickson mentioned, identity, in fact, capacity to handle things independently, develop almost all the parameters which are necessary for proper development, what we call both feminine and masculine traits. These are all extremely important for the development. So there are two components here. One, the child having some problem and certain issues. These are the people may dependent all through the parent who takes care, may not realize the other parent is actually valuable or important, or maybe unfortunately has been kept in a different situation. This is one aspect of it. The second, what actually normal development of the child itself may get affected, and these children will present with many different behavioral symptoms. Few of the symptoms what people have documented is actually, in fact, this ADHD, other mental illnesses, the child going into the depression, significant problems in psychosexual development and issues related to it. Okay, but with the child being either what we basically call, say, becoming a significant introvert or externalizing disorders. All these type of things have been documented in case of children where family environment is affected.
Understood, sir. So one more question, is there any relationship between parental alienation and paraphilias?
See, the point, I haven't read anything very specifically, these two things being linked actually that way. But all said and done, development of whether we are talking about gender identity disorders or what we call paraphilia, hypersexuality, asexuality, and a whole lot of other such related things. Apart from biology, in fact, we don't have very 100% clear-cut answer for these things even today. Psychological development wise, there are theories to explain, but many of the time the social and other learning aspects make a very significant dominant factor. Why? I'll tell you. See, a child which is actually developed properly, confident, and he can function psychosexually quite adequately. This is one of the idea. But you imagine a child who is actually very anxious, nervous, a whole lot of other psychopathological issues. He will actually prefer certain activities where it is easy and it don't generate anxiety. Let me tell you, masturbation is one of the easiest thing. That's why one of the reasons why, in fact, one of the commonest sexual release mechanism is actually masturbation also the animal kingdom and particularly the men. The second one, say take an example. I need to talk to that particular girl, fall in love, marry, and then leave. That means so much of what we call energy and the amount of what we call wherewithal necessary. And this particular thing happens. See, if a child has developed not in an anomalous situation means what? If father is not there, mother is not there. These are the type of things which can create the whole lot of difficulty for the child's normal, healthy sexual development. This is where many of these type of things. Say, take an example, paraphilia. See now, this particular child likes certain things like say slippers or certain body part. Maybe when we say make a diagnosis of paraphilia, this becomes the primary and the only way of actually the sexual release and a whole lot of things related associated with that. That means it's an easy method. Say rather than going into too many details, the important point is actually the child will find some method which is easy and he will get stuck at that particular level. And if that has actually precisely has happened, in fact, this is what actually works out to be a paraphilic. So all permutation combinations are possible as far as the child's psychosexual development is concerned.
Understood. So will there be, I mean, in future, is there any possibility of putting a diagnosis as depression due to depression due to PA, that is parental alienation, anxiety due to PA?
It is there. See, for example, in diagnosis, either we take ICD system or what we call DSM. The important point is actually that what are the other, say, for example, if you are trying to look at that fifth category, we need to mention what is actually creating problem. But these all international classifications are not adequate. See, there is another system called as the WPA system of psychosexual assessments. It actually has two major things. One is what we call the first component, which is having four major areas in that. The second component, which is actually the elaboration of the whole positivities related to this particular relationship. Coming to this first component, the first is axis 1. See, for example, axis 1 in international classification like ICD or DSM, the reason for which he is seeking help. But in WPA system, it says axis 1A for which actually he is seeking help. Axis 1B is the comorbidity, either some psychiatric disorder or medical and other related disorders. That means there is a whole lot of improvement actually. The second one, disabilities. What is the extent of disability it has produced in an individual? The third, why it is important at this particular point for your question is the contextual factors.
Exactly.
Contextual factors talks about, as far as this particular individual, this couple is concerned, say the family, education, environment, economic status, lot many other things are actually, that's where actually the parental alienation also gets into the picture. That means where, say for example, if somebody is living in Mumbai or maybe in Chennai, in one single room there are about 10 people are living. See, it will affect sexual functioning in a very significant way. That was nowhere taken into consideration in any of the classificatory systems.
True.
So this WPS system talks about the contextual factors. The 5 headings are given. Each one of these areas we need to actually document it. Then the fourth is actually the quality of life. A visual clock scale starting from 1 to 10, and where actually the individual falls in. See, it's such a beautiful way. There are already efforts to understand that these other social, other psychological factors are also extremely important for understanding or making diagnosis.
Are you following it, sir?
Only thing is, see, for example, every case we have to classify according to this available this thing. Say, hospital record means it talks about ICG.
Yeah, that's right.
This is what.
So practically it's different.
We are planning to do a research. We talk about DSM. There is no place for this WPS system to be brought in, and no insurance company, no administration.
You accept it. True. Thank you so much, sir. I think we come to the session.
Thank you.
So we have answered all the doubts over here, and thank you once again, sir. It was a very good learning experience from you and Dr. Arun.
In fact,
Arun sir, you were there. Thank you, sir.
Thank you, sir.
So thank you everyone for joining on the session, and the next webinar will be from a pediatrician perspective, and we'll be like having it on 26th, if I believe. Yeah, 26th. And we'll be announcing it. Thank you, everyone. Thank you. Good night. Thank you, sir. Thank you, everyone. Bye.
Thank you, sir. Thank you.